Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started. So I've got some exciting news today.
Go for it. I'm ready.
What is it?
Yes.
We have one of our amazing subscribers that reached out to us and said, hey, is there any way that you could dive into this topic, which I'll mention here in a minute? And so you and I dialogued about it, and we're like, we would have never thought about this topic if it wasn't for our subscriber that mentioned it. And so we decided we're not only going to do an episode on it, but we're going to put some stuff in our digest about it. So it's the topic of how to coordinate patient care well among multiple different providers. So when we think about the general docs referring his 16-year-old patient to an oral surgeon, or when a general doc is like, hey, this is beyond my scope, and they refer to a pediatric, ortho, of course, is a big part of this as well. So you and I got to talking about it. We're like, there's so much that we can talk about here. So here we go.
And I believe you said the subscriber is an orthodontist.
Yes. Yeah.
And so to me, I thought that was very interesting because I was like, which side is the side that's struggling? Is it the orthodontist that can't get a reply back from the pediatric dentist, the general dentist, the oral surgeon, like whoever they're trying to correspond with? Or is it, have they been like told that they're not doing a good job with? And so just right off the top of the bat, like I love this topic because you're right. It's one of those things that I don't think we ever really think about. And so when you start your practice and you're like, how am I corresponding with somebody and not? And in my mind, it's kind of one of those things that's almost kind of a little tedious. You're like, well, because it's details.
Yeah.
And so that means somebody has to follow up on the details. But the good news is once you've got a system in place, then it's easier. So it's like you've got to get your system in place. So I've got a couple of things that I think we could talk about here. But I will say it if somebody's going, this is tedious, it can be. Yeah. But hang in there.
Yeah, it'll be worth it on the other side. And I'm glad you mentioned that when we were thinking about this topic, of course, I was thinking about it subscribing to an orthodontist, but it's interesting how many times I'm in a general dental practice and they are commenting on whether or not they refer to somebody due to the referral process. And so it really is, yes, we need to know about it from a specialist side, but also from a general dental side, the complexities that specialty office is going through to coordinate it's complicated. It really can't be complicated. So I'm excited to talk about this.
And I will say there are orthodontists that I do not refer to because we don't hear back from you in a timely fashion. And then there are other orthodontists that I refer mostly to you because you make it so easy. Yeah. You're easy to get a hold of. You understand the question I'm asking. I don't have to, hey, how are you? What did you mean by this? But can we do this? But no. What I meant by this was that, like, if I've got an orthodontist who understands, for example, an orthodontist is sending me, extractions request. But do you understand that this patient is Frankel 2 in my office for a cleaning appointment? Yeah. So what do I, this is what, I guess if you're asking for me to extract, 2 primary canines, but we know the maxillary canines are going to be next, and I know I'm going to have to bring in my anesthesiologist to get these extractions done. Yeah. Can I go ahead and extract all 4 now? Is that going to mess up your plan? Can we be on the same page with this when the parent inevitably gets mad at me that now they have to pay V twice, and I'm going to try to throw the shade back on you going, well, no, you're the one who said we needed to wait. Like, can we not throw shade, and can we get on the same page here? So some of the orthodontists that I can work with easier on that are my go-to orthodontists. Same with the oral surgery. And if I can't get a hold of you easy, like if I don't have your cell phone number and can contact you directly, and you don't return my calls, I'm not working with you. Yeah. Or if I sent a referral, there's like 3 orthodontists in my area that I work with that I know if the patient went to go see that provider for an evaluation, I know that that provider is going to see back their findings. And then I know 2 or 3 that I will never hear from.
Yeah.
And so now the patient's in my chair 6 months later. Did you go? Yes, I did. Well, what did they say? Well, no. Well, try to I'm not doing that.
Yeah.
I'm not doing that. So it really does behoove all of us to help our patients and being a reliable, Then I've got an orthodontist I worked with that inevitably his practice grew and the communication got worse.
Yeah.
Because now he's gotten so busy and hit whatever system he had. And I finally had to say, I'm not happy with this right now. Or we got a system of where I could just text him and ask him a question or give him a heads up and say, I talked to the mom about hygiene or, whatever, possible need for a gingivectomy, possible need for a frenectomy. What do you think about all of this? And he's like, oh yeah, I'll talk to the mom when she comes in. Well, then the mom would come back and there would be nothing. And so I knew it was him dropping the ball.
Yeah.
Because he was getting busier. But, so we've got to tweak systems. And it was somebody that I could say that to and say, hey man, I talked to you about these 2 cases and it seems like, where did the ball get dropped?
Yeah.
Did you talk to the mom about this? Now, I'm not a confrontational person.
Yeah.
If I don't feel like I could talk to you about that, what am I going to do? I'm just going to find another orthodontist.
Right.
So, and again, I keep saying orthodontist because we work so closely with the orthodontist, but that could be anybody. It could be the pediatrician that, there was a pediatrician once that I suspected the kid had hypophosphatasia because this is what I was seeing. Got the pediatrician on the line. She more or less laughed at me. I was like, well, I'm just like, if we can't collaborate on patient care.
Yeah.
I'm not saying you missed a sign of anything. I'm not accusing you of anything.
No, you're just saying let's work together to help this kid.
Right. But I think the way she took it was, here was this pediatric dentist telling me about a medical diagnosis on one of my patients. And I was like, I am never working with you.
Yeah.
Because you have such an ego.
Yeah.
You have such a limited view of, here's somebody else who could be working with you and helping you.
Yeah.
And so if I don't have that camaraderie with another provider, because sure as hell, I'm sure there's going to be things that I mess up or that I don't think about or that I don't see and vice versa, things that I'm catching that I'm like, dude, this doesn't make any sense. Like, you're asking me to do this, but did you even look at the wisdom teeth on the pano? Because it makes more sense to send it to the oral surgeon rather than to me. Oh, you didn't even look at that. Well, I don't want to be the one to tell the patient, well, Dr. So-and-so didn't even look at that. Like, who are we helping?
Right.
We're not helping. We're not helping our dental field or our dental community, like our profession.
Yeah.
So, but if it's somebody that I can't talk to, I'm not going to talk to you.
Yeah.
I will find a different resource. So, I know I just got off on a tangent there, but I think for me, the point is, first of all, I think the referral community needs to be like all sides of that. If anybody has an ego, or if the general dentist is like, you're lucky, pediatric dentist, that I'm referring to you, you make it easy on me. I mean, they've kind of got a point. I am relying on you for the referral. But if you're constantly going to be throwing me under the bus for things, then I don't work with you.
Right.
And I can throw that right back at you at some point. I haven't thus far. I could have easily said, what about that patient? Why didn't you send them, a year ago? We don't do that to you.
Right.
Don't do it to me. So I think that's part of it. And then getting down into how are you making your system? So for the colleague, I had to call out and go, dude, I think you're not, what is up with you?
Yeah.
Are you busy moving your house? Are you growing too much? You bought a second practice. You were onboarding an associate. I can empathize with all that, but at the end of the day, not my problem.
Yeah.
I need this to get better. And he did. He made whatever corrections he did on his own end to make sure that our texting didn't slip through the cracks.
Yeah. Yeah. Well, and I think too, it's almost like we've got to start with the right mindset towards our referral system. We've got to have, first of all, an appreciation for it, a respect. I think respect is maybe the better word, that we're respecting whatever colleague we're referring to, that there's never a negative mindset towards that. So it's almost like we've got to have the right mindset first and foremost. And then out of that should grow a really collaborative system. One of the things that I think is really important to think about here is, to me, you've got the doctor-to-doctor communication in these referral relationships, which kind of is its own category. And then you've got the team-to-team communication. So when you mention something like like how we didn't receive a letter from this specialist, so now I'm having to get secondhand information from the parent regarding this, what all happened at that appointment. Okay, where did that break down? Was that the doctor did a referral letter? That letter never got sent because Sweet Sally at the front forgot to send a whole month's worth of referral letters. Well, now the doctor doesn't know that didn't happen. It's interesting that referral letters is coming up right now, because I was at a oral surgery office last week, and we're fine-tuning all of their systems. And one of the things that we talked about was, hey, we need to go back and talk about our collaboration with referring assistants. They primarily utilize referral letters back and forth. Now, a million different ways that you can get information, maybe not a million, but several different ways that you can get referral information between providers. They utilize referral letters, which is totally fine. But we went through and looked, how quickly is that being sent out? Is there any additional information outside of that referral letter that needs to be communicated between doctor and doctor? How is that being remembered? Are we putting that on a task board? How are we tracking that? What about the referral letter itself? Are we double, triple checking that for accuracy? Who's checking that? How many sets of eyes is it going through before that gets sent out? And as you think about it, you're like, oh my gosh, that's so exhausting. Like, really worth it? Yes, it is worth it. One, so that the providers are collaborating well, but ultimately it is for the benefit of the patient. What is in the best interest of the patient is that these two providers are working together and communicating well. And if the referral letter is our foundational piece of communication, then we have to know it's being sent out timely, and it's correct when to that.
And then whoever's receiving it is received in a timely fashion. And so it's like, it really is. And I think one of this too that I think we can get kind of, whether it's, the general dentist, who's kind of the king of the castle, if you will, on the dental totem pole, like everybody's like, oh, we need your referrals. But I think at times where general dentists will forget that we can refer back to you too.
Yes.
We see your work. And if we're like, oh gosh, no, or you waited too long to send this patient, or vice versa, if we see your work and we're like, man, a colleague of mine that I would see his class 2 composites and they were textbook perfect. So any teenager or any parent that needs fillings, he was my go-to guy because I saw how beautiful his work was. Yeah. And so dare I say, general dentist, you would imagine you would set up peds. We were sending you. Yeah. And then even the orthodontist, I think the orthodontists we think of as like, oh, we're your cash cow. Peds is sending to you, but the number of patients that ortho can send back to us. Yes. I think I don't take that for granted. Like it needs to be a win-win. And I think if somebody's kind of going, that's not my problem. Yeah. I don't need to worry about that. I think that to me is really disappointing and kind of dumb, because to your point, you're not providing the best patient care if that's the case. But also, you never know the opportunity to get a patient. Right. And so if you are easy to work with, you are quick to respond, you are accurate with your stuff, people are going to want to work with you. Yeah. Yeah. So we even had another orthodontist that we hate getting her referral letters or her evaluations, because they're kind of all over the place. Silly little things like she'll send the pano on the same document, but I can't see the pano when we print it then. Like I want, not sending it separate. She's like, oh, well, I can send you the CBCT. I don't know how to read a CBCT. I don't want to read that. Yeah. Give me your summary findings. So here she was sending me like a 10-page document. I'm like, I don't want any of this. Yeah. And so we had to go back and forth to kind of what we wanted. And then every other orthodontist sends us a separate extraction request. she was burying it in her evaluation form, so we were missing.
Oh, wow.
And then, so I talked to her about it, and then she like, oh, okay. Like, she almost thought we were the pack of idiots. At this point, do I feel like maybe I'm being a bit needy out of her? Maybe. But at this point in our relationship, the majority of the referrals are going from us to her.
Right.
So you want to keep my business, you need to start doing it to where it's going to be easier for me.
Yeah.
And same thing, in my office, I asked my other two people, I asked my associate and the other, Dr. Kavitha, who comes, I'm like, does this make sense to you? Like, what would you have thought with this?
Yeah.
And they agreed with me. I'm like, so it's not a me problem being special needs here.
Right.
I think this orthodontist, I don't know who she's working with otherwise, but I don't think I think it's her.
Yeah. Yeah.
And so, I think the easier you can make it for everybody. We also had recently a mom that came in, come to find she's a pediatric sleep specialist. And we're like, we need that because now when we're trying to refer a patient for OSA evaluation and trying to get caught up Bermuda Triangle of who's going to manage this, the pediatrician's like, no, there's nothing wrong. I had strep 5 times. Go to the ENT. Is it an ENT that believes in sleep apnea issues? And you know what I mean? Like, it becomes this mushroom cloud. I'm like, God, I hate making these referrals because I don't feel like I feel like, am I really helping the patient? Because if I send you back to your pediatrician who's going to have an ego about this or is old school, or an ENT that is old school, and now the patient's pitted against who are they going to leave, and now they don't believe me. And like, anyway, so here's a specific person I can send you to who knows we have agreed that this is a useful evaluation. So for her, I was like, okay, well, how do I refer to you? Well, it's not her own office. It's part of like a hospital system, and it's a satellite clinic of this hospital system. Okay, so how am I referring to you? Like, what am I doing here? Well, so we emailed her, and so now she had to ask her facility, well, they only want a fax. I ask you, we're in 2025 now, you only want a fax. Okay. Well, we'll come up. So we had to come up with it. We had to come up with our fax, what do you call it, cover sheet?
Yeah.
And our sheet of going, okay, these are the things this is why I'm sending this patient.
Yeah.
So now I'm starting to fax it to that clinic. And, I emailed her and said, is this going to work? Is this what you guys want? And this is how you're going to correspond back with us. Yeah. So I had to do all the legwork on that. Now, what am I gaining out of that? Like, am I gaining a major referral source that this clinic is not going to start referring to me? I don't think so, but they might.
Right.
Maybe this mom is going, my kids go to this office and I like how thorough they are.
Right.
That's how it came up, actually, because when she was in our office doing paperwork, she said, I love that you're screening for OSA.
Yes.
And it started the conversation, and that's how we discovered that's what she does.
Yeah.
And so now maybe she's not sending medical patients to us, but at least friends in her community and other physicians. So she's like, no, go there. They're more thorough.
Yes.
And we've created this system now. So I think, to me, like, regardless of there are opportunities to help both businesses, but also to help your patients, which is the ultimate thing. Now, did this subscriber, the orthodontist who sent in, did they ask anything about what they were wanting to know in particular? Like,
just our tips on how to make that referral process solid and good. So, which you're doing without saying, go do this. To me, like, as annoying and frustrating as it is, people who are consistently receiving referrals, whether that's the pediatric dentist, the oral surgeon, the orthodontist, doesn't matter. If you aren't in some regular practice of asking for feedback every so often and going, hey, these are probably the top 3 people that refer to me. Maybe that's twice a year, where that specialist is reaching out and going, hey, by the way, I want to just get some feedback on our referral process. Do you like the communication that I'm sharing? What can I do to enhance it, make it better for you? Because you're kind enough with 2 referrals that you just talked about to have been very overt with that. Like, hey, I need you to change this referral letter because we're losing the extraction request in there and it's fuzzy. Are we extracting now or are we not extracting now? communicating with your other colleague where, hey, I don't know what's going on with your communication, but it's gone way down. Like, I need you to pick it back up. Most people will just go, I'm not going to refer to them anymore. And they move on. And then when we're evaluating numbers the next year, we're like, oh no, I wonder what happened to this referral source. They just left because of something that they in the process. So to me, it's like, as a person who's receiving referrals, you need to be asking for feedback and making changes accordingly. Any specialty office that I work with, I always tell people, you've got to customize. Not everybody wants the same information, the same level of information, the same format. Like, is it a letter? What if this doctor really, really, really prefers this referral portal and you like, do I really have to change my normal routine? If you're the recipient of referrals, yes, in order to really accommodate that doctor who's referring to you and to do what's best for the patient, we've got to kind of pivot and either change our system to make it super easy for that doctor, or we may have to jump on their page and go, okay, for you, I'll remember that instead we only text back and forth about the patient, whatever the case may be. You got to be willing to be flexible in that process. But I think that starts with getting regular feedback from the people that refer to you. And not just the doctor, the team. So again, I was in this oral surgery office, and we were auditing phone calls, which is everybody's favorite activity that I do when I come in. So we were listening, and we heard a referral office call in. And so we were evaluating this employee, and this employee got the patient scheduled and then went on to ask patient's address, patient's phone number, patient email, patient's insurance information, yada yada. And so after the call ended, I was like, okay, let's talk about it, highs, lows, whatever. And then I put on my critical hat, and I was like, I do not like that we are tying this referral office up, asking for address. I'm like, do we need that to schedule an appointment? Does your software require that you have a patient address? Now, some do. So I want to be clear with that. Some require that. So we may have to actually put the appointment on the schedule. We might actually have to have an address. Okay, I can stand by that. Phone number, I get. We need the patient's phone number to be able to communicate with them. Email, I get it. It would be nice to have it so that we can send paperwork and all of that. But do we have to? Could we not follow up with the patient to get that information? Insurance, I'm like, are you kidding me? Get that from the patient. Now, their argument was, and I hear it, the argument was, well, it's the patients prefer that we get from the referral office because it's accurate, the referral office is using it. And I'm like, I get that that's the patient's preference. But what I'm concerned about is the referral office preference, because they've got a patient in front of them, probably 4 back behind them. They're drowning in tasks, and they've spent an extra 3 or 4 minutes on the phone with you going through every aspect of this patient's insurance. It is not helpful to that referral office. And what may end up happening is they find a different place to refer to that doesn't ask all of that information. So if the doctor's not overtly like, hey, you send to Dr. Smith, and they're like, hey, they need an OS referral, and they're like, okay, good. I ain't referring to Dr. Smith because they always keep me on the phone for 5 minutes. I don't have 5 minutes. I'm going to go with Dr. Jones instead because it's a 2-minute phone call rather than a 5-minute phone call. So we have to also evaluate the team's perspective on this referral process.
That is so funny you say that, because we dealt with exactly that, and it was my close, but all of a sudden, it's about 2 years ago or something, and it came out of our meetings where they were like, yeah, that's so annoying. I'm like, whoa, what are you talking about? Well, when we're sending information, and I was like, why are you doing that? So it was us referring Johnny to the orthodontist. The orthodontic office would call us and do exactly this. Try to get the insurance information, trying to do all this. I'm like, why are we doing that? We're already sending the patient to you. You should make it easy for us, and that is not making it easy. And that's what it was. They would say, oh, Johnny's mom, do you want us just to call us to get this information? What's mom say?
Yes.
So now they were hounding us because they didn't want to hound the parent.
Yeah.
And I was like, And so I went to my colleague and I said, look, I'm going to be the bitch here. Mm-hmm. I think your staff is trying to make it easy on themselves. And I can see that. But I'm not paying my staff extra to sit here and give your staff that information. Mm-hmm. That is the bitchiest thing, but I'm just going to be very direct. I don't have time for that.
Yeah.
If that's something you're just going to need, let me know. Because we will just not... If your staff is too busy with other patients, then we can make you less busy.
Yeah.
And I said it in a nicer way than that, but he got my point very quickly.
Yeah.
He had no idea his staff was doing that.
Yeah.
I think his office manager was just like, God, that bitch. Yes.
Yeah.
But nuh-uh. The gift is you've got the patient. Don't put that work back on me.
Right.
This also reminds me of, and it was around COVID, and so I tried to understand, but it was another provider we were working with for anesthesia services. Great provider, had used this provider for a decade. But around COVID, when we all lost staff and all of that, and I mean, I tried to be patient, but it's like trying to get our patients on the schedule with the information they needed in a timely fashion, to where, like, say we've got surgery cases on Monday. Well, we see this patient on Friday and they want to get on Monday's schedule. And now the provider's going, his office team was going, oh, no, we need 3 or 4 days for us to process this. And I'm like, are you out of your mind? Like, we are not serving the patient and we were losing business. Like, that doesn't make any sense. And knowing this doc, I know he would be like, that is foolery. But I don't think he realized that's what his staff was doing.
Yeah.
And so I brought it up. And again, this went on for months. And I finally was like, I can't do this anymore. We use a different provider now because they made things easy for us.
Yeah.
And so you've got to constantly reevaluate yourself then too. Am I making it easy for people to refer to me? And so we've got like an option on our website, referring docs. And so we'll refer people to that and say, hey, here's one of the best ways you can get a hold of us. But if that doesn't work for you, you want our paper referral forms, you got it. So every 2 months we're going and we're like, do you need more of these? Do you need more of these? Yep. But again, everything we're doing, and this is a detailed minutia area, but if you're not going to pay attention to it, it's like anything else. Whoever's going to make this easy for me is who's I'm going to utilize.
Yes. And ease comes down to accessibility. Is this doctor accessible when we need to be accessible? And I get the annoyance of that, but that's important. Do I have a good system that I like? Does my team like referring to this? So we can go into there's a whole different side of like marketing to these potential referral sources and developing good relationships. We're not even talking about that. We're just talking about the nuts and bolts of, is there clear communication? Is it consistent? Is it accurate? We've got to make sure that what we send out is accurate. If there was something we discussed with that patient that we did not represent in that referral letter, and we have sent that referral letter back to the original source, and they're now going in partially blind into that conversation, we have set that provider up for failure now. Because now they look dumb because they didn't know that there was this whole aspect of the conversation that happened. So we've got to make sure, if we're not checking the information that we send for accuracy, we need to be, because that can not only get the referring provider in a predicament, that also compromises patient care.
We had one a couple months ago that a mom came in and whatever she was saying, I'm like, what is her point here? Where is she going with this? And ultimately, when she finally came out, that the orthodontist sent her a letter, like a summarizing letter after the appointment, but it was the wrong patient.
Oh my gosh.
So this mom now is getting this separate, this kid that's not her kid, and she's lost trust in this provider. And she's like, well, I really wanted to go there. She's 2 minutes from my house. You told me she was really good. And I'm just like, oh my God, she is really good. But I said, I can guarantee you, she probably has no idea. This is a clerical error, and I hope you don't ding her for clerical error. And I was like, it's hard to find good team members these days. And it's hard to God only knows what's going out of my own office that somebody has stopped and sent the wrong. It could happen to any one of us. And so then I told this colleague, I said, hey, by the way, like, I don't know if you know, but this was the wrong one. I smoothed it back. She's going to come back, but whatever you need to do on your end. But you better, I'm watching those now, because if I see a couple more coming through, if I raise my flag to go, maybe I can't work with this colleague anymore at this time.
Yeah.
She's bought another practice. She's onboarding new people. She's got a lot of, things going on. But at the end of the day, like, that's going to reflect back on me.
Yeah.
Because this is the only reason we went there is because you told us to go there. So can you imagine if anything else had happened with this one? So I just think, like, yes. So to me, communication, ease, covering each other. We're all going to make mistakes and have something happen. And if we're afraid that person's going to, like, talk about an idiot we are to the patient, I can't work with you.
Yeah. I think that's one other thing that we should hit on that we haven't said is we've a lot about the nuts and bolts of communication between the offices and between the providers, but we've also got to have our referral offices back, both ways, right? So we're human. There's going to be mistakes that are made, and we've got to stand up for our providers. Now, to your point, if we're seeing repetitive mistakes, we should question whether or not we should continue to refer to that office. But so let's say the general doc is sitting there having a conversation and he realizes now that the referral letter was inaccurate, or that there was an aspect of the conversation that was represented. He could easily go in that moment, why did Dr. Smith not tell me about this? There's nothing in the letter about that, to save his own hide. Don't do that. Because now that patient has a mistrust for Dr. Smith because you displayed a mistrust for Dr. Smith. So you've really got to stop and watch your communication. Now, I'm not saying that doesn't need to be addressed. If there was something inaccurate, that needs to be communicated back to that office that sent the patient back to you. But in the moment, in front of the patient, help your referring office out and go, you know what, I'm missing some details on that. Fill me back in on part of the conversation. I want to make sure I understand that. We are like, hey, I don't have the details on that, but we're not like, Dr. Smith and his team didn't send me the information on that. Can you fill me in? No, we're just like, hey, you know what, I'm missing, fill in the blanks for me on that. Okay, we're smoothing that over so that the patient is ultimately trying to update us. We may need to go back to Dr. Smith and be like, hey, I'm missing a big part of the conversation here. Can you fill me in? But in that moment, let's support each other.
And I think it's, the assumption is you're going, has the patient lost trust in Dr. Smith? But what if they like Dr. Smith better?
Yeah.
And now they've lost the trust in you. They're like, you're trying to cover for yourself. I know that's not what happened, right? But I think it's come out smelling like a rose too. That's exactly, I'm just like, okay, I'm really sorry. I'm just confused with some part of this because I thought, you know what, I will get back to you by the end of today or earliest tomorrow. But hey, Jenny, can you make sure, just leave me a Post-it right there. Hand me the Post-it. Okay, I'm going to call.
Yes. As
soon as I get a chance to call Dr. Smith, I'm going to call because somehow I'm missing a piece of this, and I want to make sure before I guide you that I have all the pieces myself.
Yeah.
So let me get with Dr. Smith. He's really good about returning calls, whether he is or isn't. But please be good about returning the calls and being timely. And then we will have an answer for you just to make sure we're all on the same page. So your concern is this. I have this, and we're going to loop in because I know I'm missing a piece of this, but I do. Yep. We're going to get on this.
Yep.
And then you do, and you call that person, and almost always you can shed the light. 90% of the time it's the patient.
Yeah.
And the referring doctor is like, that is not what I said. What I said was this. Okay, that's why I'm glad we've got this. Then we call mom back and say, Dr. Kuba and Dr. Smith spoke. They're on the same page. This is how we would want to proceed. So we're not going backwards and going, well, you're the one who missed it. No, they clarified this. They exchanged x-rays and talked again, and now we've got our plan perfect and solid. They're on the same page. They're so excited that this is the route that we're going to go.
Yes. And to me, that communication is pivotal in all of this because there's going to be little mess ups in this. And I would also say, too, the communication of trust and that we collaborate well together. Oh, we know Dr. Smith so well. I can't wait to chat with him more about this. You want the patient to be at ease in this process. And so I think that's a critical component of having a really good connecting relationship with all your referral offices. There was one other thing that popped up as you were talking, which was an example that came up recently where the referring office, there was clear communication. And then when the communication came, they were very controlling. Very controlling. Like, oh, I want you to do this, this, and this with the patient. Don't do this, this, and this. And they wanted a lot of control in the process. So just like we would communicate trust in front of the patient, we need to trust our referring offices. So there cannot be control. Patient is a patient of the referring office. That provider has to be able to conduct what he or she thinks is right on behalf of the patient. And yes, that needs to be in conjunction with you, referring office, but you are not allowed to control that relationship. So I think that's show trust in front of the patient and show trust to your referring office.
And if there is no, if you don't think they're a good provider or doing the right thing, then I guess that's where you need to try to figure out and go, hey, I don't think we're on the same page as far as this patient care goes. I think that happened to me years ago, and there was a dentist who was trying to get me to do whatever it is he was trying to get me to do. And I'm like, but that's not, I can't do that here.
Yeah.
And he quit referring to me.
Yeah.
And I was grateful for that because, frankly, whatever he had referred to me was garbage. But in this case, I'm like, I'm sorry, my expertise jumps here, but you think that's going to make you look bad.
Yeah.
For whatever, I don't remember exactly what it was. It was like an indirect pulp cap and a crown versus a whatever. And so we just needed a part ways on that, and okay too.
Yes.
I think one other thing that you had mentioned a minute ago about being responsive, I do want to make sure that's because I know a colleague of mine, an orthodontist, was always kind of tortured by this other colleague who was like expecting him to drop whatever at any time. Like if it was a Saturday at 11 p.m. and a patient had a wire poking him, this general dentist referral expected the orthodontist to take care of it. So you don't need to be ridiculous, is what I'm saying, but y'all need to figure out what works for both of you. If I'm sitting there going, I need an answer to this because I can't finish my treatment plan because I'm waiting on you.
That's different.
And I've had to call your office 3 times. I'm not doing that. I'm going to find another office.
Yeah.
So I think, I hope we answered the subscriber's question, but to me, it does go back to systems. You have to have a system in place. And once you get your system and get your team on board with how are we communicating with this office, I think you need to figure out how you can be timely, and maybe you need to go and like you said, customize with that particular is what does timely mean. But I think you need to make sure that you are closing the loop.
Yes.
And not just like blowing this paper in the wind, well, off you go, and then we don't ever hear anything back.
Yeah.
That's a recipe for I'm moving on. I'm not working with this office.
Agreed. Completely. Yeah. And I do think we addressed all the subscribers' concerns and questions. I think this is just such a practical, like, go revisit your system, revisit who you're referring to. Does there need to be communication, clarity? Do you need to have communication with the team that refers to you, kind of evaluate how things are going there? Like, take a fresh look at this. I think it absolutely directly impacts patient care, and so it's worth our time. As we wrap up today's episode, I want to give you a friendly reminder of the opportunity that you and your team have to spend 2 full days with me and Dr. Kuba in our consulting crash course. A 2-day course that is designed for you, your team, and your practice, and nobody else. It is all custom content, custom material, including some preliminary homework so that we can address the topics that matter most to you and your team. If you are interested in this 100% applicable, task-oriented 2 days, then you need to email us today at managingdentaldrama@gmail.com. Put in the subject line crash course, and in the body of the text, sign me up. And we will get you all the details of the dates that are available, the cost, and if you want good, thorough, detailed information, check out our May 13th episode entitled The Best CE Course Ever, and you'll get all the details there. I look forward to meeting you soon.